Hello, my name is Dr. May, the Medical Director of the Richards Clinic, also known as the Pain Clinic. In this lecture, I want to show you what arthritis does to the joint. Arthritis mostly attacks the mobile joints of the body known as the synovial joints, like in the hip, the knee, your fingers. Majority of the mobile joints in the body are known as the synovial joints, and that is the joints that fall prey majorly to arthritis, especially osteoarthritis. If you remove the muscles that cover the joint, the next thing you're going to see is known as the joint capsule. These are fibrous bands that wrap around the joints. Below or inside these capsules is where you meet all the events that take place in arthritis. Because inside this capsule, you see the structures of the joints. For instance, this is the capsule wrapping around the joint, using this joint as a model to demonstrate. Immediately inside that capsule, wrapping around the capsule, is what is known as the synovial membrane. It is the function of the synovial membrane to produce the synovial fluid. Every synovial joint has a fluid known as synovial fluid, which functions as the lubricant that lubricates the joints. The articular bones, which are the bones that come together to form the joint, are covered with the articular cartilage. These articular cartilages are very smooth and slippery, making it easy for the bones to glide over each other. Then you have the ligaments that hold the bones together in this union known as joint. These are the structures the arthritis attacks. And when arthritis attacks the joint, for instance, if I can separate this joint into the heady part and the part that is attacked by arthritis, especially osteoarthritis, which is the commonest type of arthritis, you could see in this side, which is used to represent a heady joint, it shows that the articular cartilage is very smooth without any crack, without any breakage. So also is the meniscus, which is also part of the articular cartilage. And the synovial membrane we mentioned before, represented here with this yellow color, is very smooth. Then the joint capsule. The ligaments are there, like this ligament. This is one of the cruciate ligaments, very heady and all that. Now, in this part that is attacked by arthritis, you could see a whole lot of things going on there. For instance, when arthritis, especially osteoarthritis, attacks the synovial joint, it can reach to the point where it begins to break off the articular cartilage. That smooth cartilage that made it easy for, or makes it easy for the bones to glide over each other, begins to develop cracks, and at a point they begin to break off. This is known as wear and tear. Not only that, arthritis also attacks the synovial membrane. The synovial membrane becomes thickened, and one other thing that happens is that the production of the synovial fluid in some patients, due to the attack on the inflammation of the synovial membrane, increases. So the inflamed synovial membrane causes increased production of the synovial fluid, and that causes swelling in the joint. So most people that have water or fluid accumulation in their joint causing their joint swelling is as a result of inflammation of this synovial membrane. All right, so that's what happens. And also, due to the wear and tear of the cartilage, most patients, depending on the degree or the stage of the osteoarthritis, when they go for x-ray, they will be told, or the doctor will notice that the space, the gap between the two bones that form the joint have narrowed. And the narrowing is as a result of wear and tear of the cartilage. Cartilages appear as a space on X-ray. Using the knee, for instance, the cartilages that separate the two bones form this space that you see on X-ray. When the cartilages are still intact or they are still thick, when X-ray is done, you find out that there's a thick space or a wide space separating the two bones. You could measure around 5 millimeters, 6 millimeters, but at some point, that width, that space begins to narrow. It can narrow down to 1 millimeter, or even in some severe cases, there won't be any space at all. The two bones will be rubbing on each other. So the articular capsule we talked about, or joint capsule we talked about, can also be thickened. You see some patients also that have enlarged joints, not necessarily as a result of accumulation of fluid, but because of thickening of their joint capsule. Sometimes as well as the tendons, the ligaments around the capsule, and the muscles around that joint. So this thickening is majorly as a result of the thickening or this enlargement of the joint. In most of these cases, is as a result of the thickening of the joint capsule. Okay, there's also what is known as osteophytes. These things happen depending on the stage of the osteoarthritis in the joint. The articular bones begin to grow out, forming some spurs, outgrowth of bones. This is an attempt for the joint to stabilize itself because of the weakened ligaments. But these outgrowths, known as spurs, known as osteophytes, are also a problem. They cause destruction and irritation of other structures in the joint. All right. So there could also be damage of this meniscus, which is also part of the cartilage we talked about earlier on. It can break off. Pieces of it can scatter in the joint, or cracks can be seen in such cartilage. And when this happens, these patients, when they are walking or climbing staircase especially, they will be noticing some kind of cracking noise in their joint. It's as a result of these cracks in these cartilages, or even their break-off particles inside the joint. These are the things osteoarthritis does. It can also cause bone cysts and sclerosis of the bone. Sclerosis is when the solidity of the bone is hampered in a particular spot or area due to what is known as demineralization. The calcium and phosphate and other chemicals that make the bone to be strong at that particular area have all worn off. So such area of the bone is soft. It can easily break off or chisel out, causing deformity in such a joint. If it's in the knee, you have things like what is generally known as scale leg or bow leg that can happen as a result of this sclerosis and damage in the bone. Right? So all these things I have described are what happens inside the capsule. Therefore, to treat these conditions, it is important that whatever thing you are using for the treatment have to be introduced right inside, piercing through this joint capsule inside the joint space. And that's why the treatment of arthritis with PRP is the best, because this platelet-rich plasma, which is what is known as PRP in a short form, is introduced right inside that joint. And when the platelet cells or the plasma is injected inside the joint, it coats around these wounds, leading to their healing. Also, it's important that you note that it is these wounds that occur in the joint, that are created in the joint by the arthritis, is actually what causes you the pain. The pain of arthritis is as a result of this wear and tear you are looking at here. Therefore, to treat the pain without treating this wound or this degeneration is a waste of time. So the introduction of PRP inside the joint encourages the healing of these structures, whether it is the synovial membrane, the cartilages, the ligaments, or even the sclerosis. In this way, the arthritis can be healed depending on the stage of this destruction before one starts this treatment. If the destruction is not yet beyond what PRP can heal, this treatment is the best because it can heal it very well. But when the destruction is up to stage 4, surgery becomes the best alternative of treatment. Thank you very much. Trusting that you are going to share this lecture for the benefit of those who are currently passing through this illness and they are not doing the right treatment. Thank you. See you again in our next lecture.